Well, hello. Well, my role here in the second panel is just to introduce Michael Ryan, Director of Creative and Innovative Economy Center of George Washington University Law School. He will moderate this panel and on the subject we already announced, so I would ask then Michael to take it from there. Thank you, Mike.
Good. Thank you very much for the invitation to be with you at this very distinguished, shall I say, think tank. For the last several years, I have been traveling to Brazil, and in particular to Sao Paulo, about 3 times a year. And not so long ago, I was chatting with a senior American corporate executive, shall we say. And he said, "Mike, what have you been up to?" And I said, "Well, actually, I just got back from Brazil. I go there several times a year." And he said, "What are you doing there?" I said, "Well, I'm studying pharmaceutical innovation being carried out by local Brazilian companies." He looked at me and he said, "How could that be, Mike? Are you sure you're not actually just going to Brazil to go to Ipanema? How could it be the case that there's actually local Brazilian innovation in areas of pharmaceuticals?" And of course, what he was thinking about and talking about is what we Americans have as stereotypes about Brazil. Stereotype number 1. That guy Lula, right, is a trade unionist. He can't possibly be creating the public policy environment that we heard about in the first session, in which Brazilians will tell you it was Cardoso who initiated some of these ideas, but in fact it was Lula's administration that put this into place, and in fact they would say improved some of those laws. Then, of course, my American friend will also point out to you, he says, "Yeah, but what about all that compulsory licensing, which our friend down here from Merck said he wasn't going to ask about?" And I say, well, that indeed is still truly the case, but it is also the case that there is local drug innovation going on, and that there is a very positive patent environment, at least in a legal perspective. And we heard some things about the public administration system being rather weak, and there's some other things we could look at. And then finally, my American friend would point out to me that he knows a good deal about Geneva diplomacy as carried out by the Brazilian Foreign Ministry. And as he said to me, he said, "You know, that seems pretty antithetical to an innovation environment." To which my response, I would have to say, would be, "That's true, sir, because it's a very deliberate anti-intellectual property policy being carried out by the Foreign Ministry of Brazil in Geneva. And many Brazilians that I engage with are willing to say there is a contradiction there, and it's something that we probably need to be thinking about, talking about, and trying to resolve." It is the case, by the way, that I have a new study which studies Brazilian biomedical innovation. I compare it with Jordan, and it's on the table outside. I've also done a couple of profiles in innovation. One of them is of the name of the guy who is mentioned as being a key thinker as well as data gatherer on this, which is a guy named Carlos Brito Cruz, who may be more important than any other single person. He may be the most important person of all in Brazil for having helped try to create this very dynamic, emerging innovation environment that Brazilians have been trying to create. And I might add that he has a very important role in the history of Unicamp, which will be the second presentation we have. And then finally, I want to say there's also, however, a profile I've done that's a joint profile that is a public-private partnership. I call them the unhappy partners for pain relief, because there's extraordinary opportunity in snake toxin research, which Brazilians have done a lot about, and the effort at partnering with the private sector has been fraught with many difficulties. And in fact, the company BioLab was on Ricardo's list of companies, and I note in particular that it said since 2001 they've been filing for patent applications, but it was listed as no new information yet about whether they'd received any. So that's only one, but there are other problems that they've realized they confront in trying to take research out of the laboratory and put it into the private sector. We are beautifully positioned today with 2 excellent people and then somebody as a commentator to try to explain to us what has been happening, was very positive about private sector development, was very positive about public sector research and the new interest in focusing on the private sector and technology development. And the first presentation by Katja, I think we're going to find quite impressive what they're trying to do and how important the potential drug innovation here could and one hopes will be, and what impact that could have on international public health. The second presentation by Diogenes, Unicamp, everyone tells me when I'm in Brazil, has the best technology transfer operation among all the universities in Brazil. And so it behooves us, I think, to listen to the experience there. It is indeed, I guess, the case that Dr. Brito Cruz, the scientific director at FAPESP today, was some years ago a founder of making all that happen. At any rate, I think we're going to be really beautifully positioned to hear two very good presentations on the public-private partnership aspects and how the development process in the private sector is being made to happen now. Katja, welcome.
Thank you, Dr. Ryan. I would like to thank you, the Wilson Institute and Perspectiva, to give us this opportunity to discuss the problems we have in Brazil as being a biotech company. Okay, the name of our company is Genoa. Genoa is the front sail of a sailboat, and as we are salesmen and dedicated to genoma study, we put this name on our company. I will talk briefly about the biotech in Brazil, the situation of biotech companies in Brazil, and then I will tell you the story of the Genoa and the problems we have in Brazil to set a biotech company. For innovation, we all know that you have to have human resources, capital, that is extremely important, and infrastructure. Brazil, as Dr. Ryan have mentioned, is very well known by the good music and Ipanema, etc. But everybody is, what are you doing biotech in Brazil? It's a kind of a strange thing to talk. But 10 years ago, an emblematic thing happened, and it was the sequencing of Xylella fastidiosa, that is a pathogen of the orange that is very important for the production of orange, an important product that Brazil has. This project was responsible for the formation of hundreds of very well trained technicians, biologists, and set up a lot of good offices and laboratories all over Brazil dedicated to this development. And it was very important for the human source formation of good scientists. And the other field that Brazil is very well known and it's very, very good and very important, it's the development of energy, renewable energy, and new sources of energy instead of using oil. And Brazil is 30 years ago started the production of alcohol. That it was at the first crisis of the oil in around 70s, and then now we keep doing this and extracting fuel from other seeds and other sources other than sugar cane, etc. I will talk specifically of biotech companies, and in this number are not the pharmaceutics are not in this number. In the last report of Biominas Foundation, it was from last year, there are 71 companies that you can call biotech. Half of them has less than 5 years, are very new, and 1/3 of them are inside the incubator spaces. And these incubator spaces are, I don't know if you have already visited one in Brazil. They are almost always linked to a university, and they are more represented by a space and very little facilities that you have to start a business, and it's very simple. It's not compared to the incubators that recently were founded in near Oxford in United Kingdom. As you have a very special, very expensive equipment that is the synchrotron that a lot of industries, a lot of companies, new companies will try to start from this point using this there are simple and not sophisticated as we would like to be. Most of the biotech in Brazil are related to the industry, and in human and animal health, 30% of them are related to them. That are our area. Intellectual property is the measure of the development, and as you can see in this report, almost all the biotech companies has known intellectual property or has at maximum 3. It's a very sad situation. If you compare, you already saw this chart, this graphic before, compared with United States and some countries of Europe and in Japan that has increased it, and it's now better than Germany. We are very, very far from the innovation. If you compare Brazil with another developing countries like India and China, the disproportion is enormous as well. So we are very far from the ideal or a good thing that we should consider a good country for biotech and innovation. Also, the size of the biotechs are usually very small. Almost all of them has less than 20 employees, and almost a great majority of them has no revenue or revenue very, very low, less than $700,000 a year. But if you compare with Europe, the majority of biotech companies in Europe are small as well, and you can see in this graphic, and the majority of them has less than 30 employees. I will tell briefly about Genoa, just for you to take an idea of what represents a biotech company, a private biotech in Brazil. Genoa is a Brazilian-based biotech company that was founded in 1999, and as a spin-off of a traditional surgical and molecular pathology laboratory. We are pathologists, the founders of this biotech company, and the main products were at that time the dendritic cell vaccines to treat cancer, the therapeutic dendritic cells cancer vaccines, and molecular diagnosis. Those were the first two products that we have. Since the beginning, we tried to organize the enterprise to growth and to be a real biotech company and capable of getting fundings and however. The main shareholders of this company are the previous owners of the laboratory, the traditional laboratory of pathology, and now BN Spur, the Bank of Development of Brazil, is a partner of the company. They now have 20% of the enterprise. They have been very good partners. They are very supportive, and they are always want us to grow and to be successful in our business. And so this is the organization of the enterprise. Since the beginning, we have a board of directors and a scientific advisory board that has driving us to the correct way or the best way to develop. We have two businesses. We have services related to molecular diagnosis and genotyping of cattle, etc., and research and development. So we have two parts. We have health, human health, and animal health, both parts of company. Our staff is very, very nice and very well-trained people, almost everybody with a PhD, and a lot of them with experience abroad, with PhDs and postdocs in Stanford, etc. And an important thing is the management of the enterprise as well, not the scientific part, but we are worried in setting a very, very professional management for the administration of the enterprise. 3 minutes only. But I would like to show we have this staff, but we need more than this, and so we have to arrange a nice partnerships that we did with some scientists from Johns Hopkins and from University of São Paulo and from University of Alberta, Canada. So we have very nice human resources. Our projects, we have two projects. One is the developing of a therapeutic vaccine to treat AIDS, and since I have short time, I will not explain the whole project. And the other one is the search for genetic markers for the commercial bovine traits. We have more than 200,000 cattle in Brazil, occupying an area larger than Mexico, and we need productivity from this cattle. So we are searching for the genetic traits that increase the production, the productivity of the bovines. The intellectual property was already shown. We have those patents already registered in INPE. But our main difficulty is funding. Funding is the main difficulty of biotech company in Brazil. We don't have venture capitalists interested in investing venture capital in Brazil. The venture capital is translated in Brazil as risk investment. They don't have culture of investments in biotech. They want their money in a very fast way. That's impossible when you are talking about biology and biotechnology. And our partners and the investors in biotech in Brazil so far are the BNDES, the Development Bank in Brazil, and FINEP. This is a foundation that invests in studies and projects. So this is our main problems. And as we have investments from the banks, you have a lot of difficulties as well, because you have limitations for the investments that you have. Your money have to go right to that thing that you project at the initiation during the initiation of the project. You have to have guarantees, in general, bank collaterals with high interest rates, high interest rates, and the time from the presentation of the project until the release of the money takes usually 2 years, and it's a long time for a biotech to wait to go ahead with a project. And but I just want to address here that we are in Brazil, we are working there, and we want to stay there to develop the country. We want to be a very nice and very good biotech company. We don't want to go away. And everybody said, why don't you put your company in United States? It's much easier to get money, to get funding, and everything will function better for you. But this is not what we want. We want to stay there. We have a family, we have kids there. We want the country to be developed and to be as much important that we believe he is. Brazil is a very, very nice and good country. Thank you.
Very good. Thank you very much. There'll be an opportunity during the question and answer session to follow up more and probe more with respect to your business strategy and the challenges you face. Diogenes, please.
First of all, I would like to thank the Woodrow Wilson Center and the Perspective for the invitation. Actually, I was asked to talk about challenges, opportunities in the Brazilian arena, especially considering the view of a university. And once we are talking about breaking the rules, break the law, we have to break one law. I actually want to be a little bit controversial. We always been said that dealing with technologies are only researchers that don't know anything about management, or managers that don't know anything about technology. And this is wrong, actually. We do have, and in Brazil has plenty of cases. In the US, you have much more than ourselves. And we can both worlds meet. The business world and the university world and the science world can really work together. We have been talking during the day or during the afternoon about the business environment in Brazil, which is actually, I will pass this very quickly. We do have a set of regulations and laws that really are stimulating the innovation the innovation in Brazil. What we're not doing is really using them at a full extent. So because it's kind of new for us. We do also have a very nice business environment. The country is growing. We have had for many years a diversified service industry park, and now we are seeing Brazilian companies becoming multinational, transnational companies. We have been hosting international companies for quite a long time. We have a great internal market, and also as a hub for all the Latin American markets. And what is the role that so we are kind of ready to play this kind of game. And one of the things that really I guess can make a difference, in making innovation be part of the agenda and also produce sound results and significant results, is this discussing or putting universities really into this chain. And we at Brazil, we have at least 30 or 40 major universities that can really have significant science and knowledge that can be transferred to the public, generating big hits. I would say it's a significant number. And I'm gonna use one of the University of Campinas, Unicamp, as just one case, but you can mirror this example as many other universities. Just have to change the name. For example, Unicamp is responsible for 70% of national research. It graduates 10% of PhDs in Brazil alone. Has a really high number of top-rated masters and PhD programs. What is the meaning of that? Yes, we do have big, juicy, good universities in Brazil. Unicamp is just one of them. Also, at Unicamp, very recently, 5 years ago, we decided that we actually have to do a better job in terms of teaming up with external parties. Why don't create a technology transfer office or what we call innovation agents? And so then we create Innova Unicamp. But different from here, actually, we kind of want to be a little bit more creative. It's a one-stop shop. It's an office that's going to deal with license. It's an office that's going to deal with intellectual property. It's an office that's going to deal with entrepreneurship activities, government-sponsored projects. So if you are talking about external parties, you're going to find a place inside the university that's going to be your entry door. And that's the idea behind this kind of concepts. It's so difficult to find people in university that can actually make this kind of deals and organize these things. So that's the idea of the office. And as many other offices that we have here, we can make tech transfer agreements, so we can license technologies. We have to be able to take care of the IP, which is a kind of taboo inside of the academia. Anytime that I'm talking about patents, okay, I'm gonna decrease the autonomy of the scientists and things. No, I actually have proof that excellence in academic performance, publication of papers, has a very strong direct relation with the intellectual property and the success of technology transference. We have been able to show that. And if I want to willing to deal with external parties, with the market, I have like to start talking like that. So, for example, at Innova, we take care of trademarks as well. Actually, last year, I guess we are the first university in the world that made a license of a patent with 2 trademarks together. We did last year. So, because we felt that for this particular case, that was an important asset, that kind of industry, for instance, interested in that technology, also could benefit from that. So why not to do that? And it's very important for us, like, to have, I would say, the biggest asset that we have is our networking, or our, I would say, mailing list. The number of institutions that we have that can actually be potential or future partners, or let's say, using a business word, future clients or customers. And we do have like examples to show. We're talking here about biotech, and for example, this is like a medicine that arrived in the market last year. It was the first medicine that was fully developed inside the university since 1998, and actually reached the market last year. It takes a long time. You have to be patient because of the cycle of the development of a medicine. But now we have like real cases to show. Maybe to convince some other pharmaceutical companies it's worth to make this kind of investment. Also, we do. This is like another case that shows we just licensed a patent to this company here against diabetes, but it's like a 5 to 7 years development project. So they're kind of going to invest five years with us in terms of finishing development of this thing, in order to make money probably in 8 to 10 years. So, yes, we considering the environment that we have, intellectual property environment, the incentives, the laws and the regulations, and the quality of the people that we have, and not only in academia but in industry, yes, we can also be able to show, to prove to other partners that we can engage on that, we can make really long-term commitments. Because any time that a company, pharmaceutical companies, make a commitment like that, it's like a huge investment for them, in terms of not only money, but in terms of time and resources. And yes, we in Brazil, I guess we are able to do that. I guess we just have to do a better marketing advertisement job, in terms of showing people that a lot of these things are happening in Brazil. And maybe if you like take a look on that, maybe we build a little bit more confidence. In Brazil, things to be a little bit more difficult, because we always have to go to the extra mile in order to convince, because you still don't have like, it's not a country that we have like a tradition in recognizing, for example, the role of universities in fostering innovation. So that's why we do have, especially internally as a tech transfer agency, you do have to go to the extra mile, extra effort in order to make this kind of projects happen. And I would say that's the best slide of the presentation. Like you have like companies of all sizes or different segments, spin-offs, major companies, Brazilian companies, multinational companies, which shows that, guys, in Brazil there's a lot of universities that are ready to make this kind of like fostering innovation for different partners. So this is just one case. This is just Unicamp. Actually, have like a chart with like 500 logos at our office, but in order to have all this happening, you really have to recognize as a university what are your strong points in terms of research content. Because if I'm not doing my homework in generating good knowledge, it's going to be hard to like convince other partners to embrace or to invest in these technologies, especially early stage technologies. And we have like to say that in a way that the market recognizes that. So for example, we have this chart which kind of shows some of the efforts that we're having. It's kind of some of the science that's been generated, it has been transferred to private companies. But this is quite different, for example, from our internal organization. We are organizing traditional as any other universities by departments. And departments sometimes they don't really follow the market rules. And actually we have to do a lot of homework inside in order to team up, for example, the medical school with the pharmaceutical department, with the biology, in order to make this phytotherapeutic or medicine for that specific company. And this is, I would say, we do have, there is a lot of agencies and universities in Brazil that are being able to come up with this very nice projects that can be more appealing to the external partners. As I told you, IP is much more today. We're not really worried about numbers. Although we have like a really sharp increase in numbers in terms of patent applications, but it's not only we could easily have like 100 patents a year, 150. But actually, we have been very picky, like in selecting only the ones that we feel that could be really transferred to the public. Otherwise, why to have a patent? Why to make this kind of investment? If you're not really, if this is not making a difference in terms of commercialization, that's I guess investing more in quality than in quantity, which reveals a very interesting thing. You are kind of like becoming mature in terms of recognizing the real role of a patent. And I would not exchange the 50 patents that we have last year for like the first 200 and the last 10 years. Because more important for us is this license rate by number of patents than the number of patents. And we are like, you know, on average, like 25% of our patents are being licensed, which is a really good number for a university considering anywhere in the world. We need to make a better job in terms of marketing what we have, like having this kind of like talk, communication, or marketing tools that can show what we have inside. For example, this is a catalog of all the 500 patents that we have, or the patents that are available, looking for a partner. What is this slide is showing? Okay, we are improving our marketing capability in order to attract the partners, but it's still in Portuguese. So maybe we should do a better job next time. So, but things are happening. Probably if you go to the website in 2 months, you're going to see all these 500 pages in English with a short description, target markets, and things like that. So, and more important than anything, in my opinion, we have to find our place. We as a university are going to belong to the first discovery, innovation, prototype phase. We have to like leave engineering, production, marketing for the guys that are really making this thing, really making the innovation, which is like bringing a product into the market. That's the companies. Sometimes we are seeing a lot of problems in Brazil because the companies are coming to us. I want to reduce the risk, so I want like a product-ready thing. Sorry, guy, this is not the place that you're gonna find. And sometimes this generates some frustration, but I would say it's a learning curve. If you and sometimes I see universities trying to like sell products, and this also is not gonna help because anytime that they go to development phase, they fail miserably. They are really bad with deadlines and things like that. So. If you really recognize that what is my part and what's your part and how they complement our skills, we can make more of the cases that I showed before more often. Another thing, we're talking about management process. So we need innovation process. I need to have a process, simple, few boxes, only to make my partner recognize what are the steps in order to set up a partnership. We try to make this as simple as possible. Maybe 5 years ago, this kind of like chart had like 50 boxes or so. What else we can do? There's a lot of things I guess that we can do in order to seize the environment that we have to foster innovation in Brazil. We can maybe have like what we call innovation laboratories, a place where private companies can develop the products inside the university, which is like a very break of paradigm in public universities in Brazil. For example, we have the InnovaSoft in Unicamp. It's Laboratory of Innovation in Software. It's a building where we have like incubation of software companies, pre-incubation of software projects, and also I have companies like Intel, IBM, and others have like a space for themselves to develop the projects they have with the school. So this is like, I would say, a way in order to make this more appealing for private for external partners. We do some other things. We recognize that it's not easy to license a technology to a company because it's not really ready for a mature company. But maybe we could transfer technology by creating spin-off. All right, so let's have an incubation, incubator, or also let's have also pre-incubation of projects. Sometimes we lack people, that entrepreneurs. Let's train these people. Let's help them to write a business plan before they even have a company by themselves. And maybe they can be better candidates to apply for a position or to a space and into the incubator. We also have to look like for different sectors and potential customers. I work for the government because I work for a public school. And anytime that we talk about government, we say, you always have the feeling the service could be better, the process could be better, everything the government could be better. So why don't we transfer technology for the government? So we created an area at Unicamp, which is involved in the public sector. We are kind of have a lot of technologies, for example, engineering technologies that also could be used for the public sector. And the transfers in this case is much easier because there's not just too much negotiation or business, like would say recognition, or, so that makes the process quite easy, and also eases the resistance, internal resistance against the tech transfer activity inside the school, because nobody can complain when you're transferring technology to the public sector. We also want to make like, we are creating a lot of business leaders in Brazil. So why don't we have these guys connect to us? Like we have like what we call a group, a relationship group, like from spin-offs from the university, CEOs and directors that can help us with internal projects, in pre-incubation, like mentoring activities. We foster innovation among them, and also they can be future partners for projects of the university. And there's more that we can do. Maybe we are thinking about having a technology consortium, a model that we have here in the US, but we don't have in Brazil. Why do not try to set up this kind of idea? And the last thing that I want to talk, well, we've been talking a lot about investment, and lack of investment, especially for the spin-offs in Brazil, is a reality. And one of the things that we are doing, we are seeing a lot of seed capital funds that may be willing to invest in Brazilian universities. So we'll be making this call in Denmark to offer a possibility of having a seed capital fund for clean technologies of Brazilian universities, where the Unicamp will be like making this offer with the Danish government and other players. And so, because in order to like trying to find better ways or to stimulate to foster innovation and to like close the gap, the small gaps that we still have in our innovation process. That's it. And well, in terms of challenges and opportunities, I would say my big challenge today is like to have more time to make more projects, to have more people on my team, because I cannot even handle the demand that I have. So, and I can say there's a lot of other universities in the same pace. So I invite you guys to join this very exciting environment that we're having today. Thank you.
Thank you. I'd like to introduce Rahim Rezi to you. He is a PhD candidate at the University of Toronto. He's a specialist in global health, but in particular studies pharmaceutical and biomedical innovation in developing countries, and is the author of a recent paper that appeared in Nature Biotechnology concerning these activities in Brazil. Welcome.
Thank you very much, and thank you for inviting me here to present to you some of our findings. It's been a great discussion, I think, all day long, and in the danger of repeating some of the things. I'll just go through this presentation fairly quickly. I'm at the McLaughlin-Rotman Center for Global Health. We're based at the University of Toronto, University Health Network in Canada, in Toronto, and we are a center that specializes in global health, particularly biotechnology development in the developing world. As part of this study is part of a series of studies in India, China, Brazil, and South Africa, led by Dr. Sarah Frew, who's actually in the audience today. So thank you, Sarah, for all the assistance, as well as Dr. Steve Samet, who's also with us. He's a collaborator in this work as well. And since we introduced him to a couple of our friends in Brazil, he's become quite emotionally involved, and he seems to be there every second week. He's doing a boot camp in a few weeks in September, just before the BioLatina. So if any of you are interested in building up those entrepreneurial skills or sending your friends, that would be a great thing. I want to just start by a brief history of Brazilian biotech. This is a busy slide with a lot of things, but all I want to highlight essentially is that Brazil has been involved with biotech sector and involved in biotechnology, thinking about biotechnology for quite some time, with the creation of Embrapa and PEPASP in 1970s, which sort of solidifies, institutionalizes science and technology for the first time. And there's a number of events. Anvisa, as their regulatory agency, comes about in 1999, for example. Sectoral funds are a set of funds that are meant to stimulate innovation. You've heard some of these things, but there's a sectoral fund specifically for biotech, and they came about in 2000, 2001. Perhaps one of the most important events in the last few years has been, that's the innovation law, which, as the clap suggests, has been fairly popular with the private sector, and hopefully will have some promising impacts. Our particular study, the objective was to explore how the domestic biotech sector in Brazil contributes to the development of health technologies that are targeted to addressing local and global health needs. We focused primarily on 5 main themes: 1, history of firms, products, services, what capabilities they had, what incentives and barriers they faced as they go about their everyday business, what are the types and nature of partnerships that they involved in, human resources and financial environment, and so on. These are the firms that we studied. They are in 5 different cities in Brazil. There's 20 companies that we studied with 4 public institutes, 3 of which were at Fiocruz, and 1 is the Butantan Institute in Sao Paulo. I want to just very quickly give you a snapshot of what the sector looks like by going through a few case examples of companies and exactly what some of the issues are. This one, for example, is Gross Laboratories. It's a very old company. It's been around for quite some time. Their business model essentially is making some of the products, old products, from themselves, but essentially acting as a distributor for other people's products. And the model here was, I call it innovation impossible. It's essentially, this company thinks that for most companies, other than the top 40 in the world, there's no point in investing in R&D. It costs too much to develop a drug. We can't do this in Brazil, so let's just pack our bags and distribute stuff, and that's it. And the challenges that they presented, which also reflect some of the other consensus sort of opinion in companies, all regulatory challenges, and Anvisa, being a fairly new regulatory agency, has some challenges of its own related to human resource training and the training of these individuals in an industrial setting and their understanding of it. Lack of experienced staff was part of it, and mixing politics with their business was one of the things that this gentleman thought that affects his business adversely. Europharma is another large company. It's family-owned. It's about 35 years old. It's involved in generics manufacturing, produces lots of products. The growth strategy of this company is to in-license proprietary technologies from abroad, enter into the biotech area via biogenerics, continue or conduct some in-house research, which they call incremental and radical innovations, and expand and replace facilities to meet FDA standards to facilitate exports of their products. Ache is again another large Brazilian company, generics manufacturer. It has over 2,000 employees, over $800 million in revenues. One of the first product that they invented that was their own work was this product called Ashoflan. It's a topical anti-inflammatory. And the challenges that they faced in that regard was the skepticism of phytomedicines in general, CG, which is a Committee for Protecting Genetic Inheritance and Phytomedicines. The way they enforce rules tend to cause problems for some of the companies, and this is one of the things that they complained about. And there was a lack of preclinical infrastructure to do their actual testing. Cryopraxis is a spin-off of Sylvester Labs, which itself is a biotech company, fairly successful out of Rio de Janeiro. It's a private stem cell and umbilical cord bank, but the reason actually this company came about not to start the cord bank, but to start a stem cell research company. And the way they figured how to subsidize it in the absence of venture capital and financing and so on was to form this stem cell bank as a revenue-generating model where they could then invest in research, and they're doing that already. Cohenfire and Receptor Biopharma, these are two companies out of Sao Paulo. They're pure R&D companies in the sense that they don't have any products yet, but they're working on a number. They're born out of what I call divide and conquer strategy. This is a common strategy sometimes used in the developing world, particularly when you don't have financing and the companies don't want to take risks. So Cohenfire, for example, is a collaboration between Biolabi, Uneo and Aché. Receptor Biopharma is a collaboration between Ludwig Cancer Institute out of Sao Paulo and another company, another sort of private consortium funded by government partially. Now this business is. So the idea is that if you don't want to take the risks individually, take the risks collectively, and that seems to be gaining some momentum in that sense. There's something called a virtual business model, which these two companies are enforcing. If you go into their companies, they don't really have anything per se physically. They have a team of people that coordinate activities across Brazilian universities and public institutes. And this is a model that essentially is the core element at this point of innovation in Brazil within the companies. Pelonova, I put this here because this is an example of classically what is supposed to happen. This is two researchers at the University of Sao Paulo are starting esophageal surgeries in dogs, and they find a particular latex membrane that seems to work effectively. They patent the idea. Again, something that's not very common in Brazil, unfortunately, not common enough. But they patented this idea. They started advertising it to investors. And this gentleman, Osiris Silva, who probably Brazilians would recognize, is the chairman of the board of this company now. He was one of the founders of Embraer, the aircraft manufacturer, or one of the fathers of Embraer. The company now has $7 million invested from VCs and angel investors. It's developing the product for a number of indications, already selling it. In fact, the active ingredient has been isolated, and it's being developed for a bunch of other things as well. So the overall barriers and challenges that when we interview these companies, they present they can be classified to a number of categories. One is systemic infrastructure issues. This has to do with lack of GLP certified preclinical facilities for toxicology testing and so on. Importation of goods, which people say is very taxing and slow. There's an insufficient institutional transparency, which makes things challenging sometimes. And there's a regulatory and legal challenges, which, again, vary depending on what the institution was talking about. But, for example, in Anvisa, which is the Brazilian FDA, the main issue seems to be that the learning process through the organization is fairly slow. So the people they've hired are very educated, have PhDs and so on and so forth, but they don't have industrial experience, so they can't relate to the challenges of the industry, and that sort of it makes them almost enforce laws too strictly, is the perception. CONEPI is the ethics board which approves clinical trials. Again, it just takes a long time to approve the process because of the fragmentation of the approval process and so on. And there's a number of these organizations. There's also cultural issues that a lot of people brought up, was weak university-industry interactions. And there's a number of issues related to this which we can discuss in the question period if you're interested. So the other challenges related to human resources is that this is a common sentiment in Brazil that people say universities only train university professors. They don't train people for the industry sufficiently, and there needs to be some rejigging of the university programs to allow for specialized training. The strict labor laws and public policy, public sector incentive systems tend to also affect the human resources, the ability of companies to hire human resources. There's some political issues that people said every time the government changes, there's a drastic disturbance throughout the civil service, and that affects their business and how things are conducted. That hasn't been an issue of late, but nevertheless remains at the back of the people's minds. There's lack of sufficient coordination among policies and laws. For example, when we talk about the innovation law, which is meant to allow industry collaborations, in university-industry collaborations. But when you go to universities, people say it is very difficult because university policies often are not aligned quite with the intentions of the innovation law. So there needs to be an alignment of those policies, I think. The intellectual property issues has been discussed at length. The major issue that people bring up that it takes a long time to get a patent in Brazil in pharmaceuticals, and that partially has to do with the fragmentation of the patenting process in pharmaceuticals, which has to go through ANVISA after it goes through the INPI, their patent office. And there's, again, issues related to that, increasing the risks for entrepreneurs as a result, preventing them or preventing some from investing in high-risk projects. The financial challenges, the high interest rates, of course, an issue in Brazil. The low level of private equity is an issue. These are not unique to Brazil. They're everywhere, particularly in emerging economies in India, China. The same issues exist. And the way essentially the companies deal with it is through those hybrid business models, through generating revenues and so on and so forth. So they have been very creative in dealing with these challenges, although they can be very difficult. The innovation strategies that the firms are using at this point, essentially you can say in the existing mode, it's a hybrid mode where they're making money from one place and investing in another. In the short term, they're using a divide and conquer strategy like Conphar, Incrementa, Receptor B Pharma. They're tapping into ideas at universities. They're using these virtual models. They're in licensing of technologies from abroad. So a whole host of strategies to deal with the challenges in the context of Brazil. And the medium to long term, I think, particularly the larger companies, are hoping to build some R&D capability inside to internalize some of those know-how to help them advance. So I just wanted to leave with a few key points and policy considerations as we've been talking about some of these things. And I think that health biotech sector is in general different and should be treated accordingly is one point that I think one has to keep in mind when setting policies. It's different from most other industries. It's becoming increasingly global. There's the gestation period, the challenges with IP, all of that stuff. And I think at the policy making stage, people making policies really need to appreciate those intricacies, because to allow them to build in the next thing, which is institutional flexibility right from the beginning. For example, the biosafety, biosecurity laws in Brazil are put in place to protect people, to protect the environment, and so on and so forth, and to compensate the indigenous people for the knowledge. But the way they're enforced, and in a strict sense, sometimes has what some of our American friends would perhaps call a collateral damage, where you don't intend to apply it in a certain way that it ends up applying. So it's, generally speaking, for example, the genetic modified organisms, when it comes to plants, are very controversial, gather media attention in Brazil, but that seems to spill over to the health effect too. So that when you are making a particular innocuous enzyme for a diagnostic test or something, people will be as strict, and that makes it more difficult. The organizational performance, I think, is very key, and here I say that the devil is really in the details. It is great that to have policies that are effective, well thought out, and all that stuff, but you have to appreciate that at the end of the day, those policies are implemented by people. And one of the things that we take for granted in the developed world, I think, that once the policymakers do their job, then there's that infrastructure that takes it and carries it forward. And in the developing world, unfortunately, that is not always the case. So one has to pay attention to the whole chain all the way down to implementation. And that can be affected drastically by structure and makeup of organizations, particularly government organizations involved in regulations, oversight, and so on. In my mind, the goal of government policies in this respect should be essentially to de-risk investment in health biotech. Okay, so by supporting innovative activities, by identifying and removing obstacles to innovation, by not directly competing with it, by clarifying the role of the public sector, for example, in health product development in Brazil. This is an issue that I think we've been discussing about intellectual property and so on, and whether Brazil is for or against it. I don't think the issue is for or against. In my mind, at least in the area of pharmaceuticals, patents for pharmaceuticals, Brazil has not quite made up its mind. I think it's trying to balance the interests of public health with the interests of the industry, and I think it's still struggling with that, achieving that balance. And where that balance is and whether it's achieved is another issue. But in my mind, I don't think that decision really has been made in a solid way, although they've been moving gradually towards intellectual property, recognizing the importance of it, and so on. Better support of innovative firms. Again, there are some mechanisms exist, I'm told, by companies. Laws allow the government to procure some of their products, for example, but the government is hesitant to do that for a variety of reasons. So that's part of the strategies that can be used. And attention to policy implementation, which again comes down to organizational structures and effective management and so on. I'll leave you with this last point, and that is the importance of first successes. To me, I always think, how does the government know it has done something? When is the point to leave or start to leave? And I think the role of government is very important, at least to the first success stage. And things tend to kind of snowball from there. For example, Ashiflan, and this is true in the case of companies and countries. Ashiflan is this anti-inflammatory product which has been very successful for Aché. It has stimulated the company to invest in a number of other products. Now they have 4 or 5 other ones in the pipeline. Recombinant hepatitis B vaccine in India by Shanta Biotechnics, for example, not only reduces the cost of this vaccine for the Indian population, but also has given new life, breathed new life into the sector as a whole almost, because they say we can do this too and we can do this in India. The meningitis B vaccine in Cuba, I think, has been a classic example. Developing countries particularly benefit from Cuba's expertise and stuff, and part of it comes out of this self-confidence that they achieve through the meningitis B vaccine. Gendicine, another gene therapy product, the only approved product of its kind in the world for head and neck cancer by SciBiome, a company in China, does the same thing for China. So it's important, I think, to pay sustained attention to get to that first success, the first few successes, and hopefully once you get there, then things can develop a life of their own and feed onto themselves. Thank you very much.
Thanks very much for a very clear exposition on the state of biotechnology and medical R&D in Brazil now. May I call on members of the participating audience to raise questions and comments? Please, sir.
Thank you. My name is Everton Lucero. I'm also at the Embassy of Brazil. I am responsible for science and technology cooperation. And in my present work, I am dealing with preparations of the second Joint Commission meeting on science and technology between Brazil and the United States, which will take place late October. And it seems to me that one of the main items for our agenda will be that of innovation, and how to foster, how to improve cooperation between our two countries in the area of innovation. I think that Brazil has a lot to learn from the experience that the United States has on fostering the promoting the approximation of companies and universities, and I think that it's something we really need to explore further. So I would like to ask perhaps Diogenes whether he has, in his experience at Unicamp, has there been any contact with U.S. counterparts to create that set of procedures that you explained and which has been very successful up to now, or do you think there is room to improve it or to approximate to to the experience that U.S. partners might have on that? And while I have the floor, I'd like also to comment on the introductory remarks of Mr. Ryan when you referred to my colleague's performance in Geneva at WIPO, which I don't agree actually, but I respect your opinion. In fact, it's just an opinion, and I think that my colleagues in Geneva, what they are doing is to implement some foreign policy guidelines that are not defined out of the blue, but rather are an emerging consensus development within the country, taking into account the national interests, which, by the way, led us together with Argentina to present the development agenda at WIPO, which is now taking place at the implementation stage and has been widely and successfully supported by the vast majority of developing nations, which need, in fact, a space and a channel to be listened to at this multilateral forum regarding IP. But this is not actually an issue for this current penalty. I just wouldn't like to leave it unanswered. That's why my remark. Thank you.
Everton, yes, there is always room for improvement. There is always room for setting up better procedures, but as specifically for our office and for university, sometimes I actually have to play both roles: institutional role, like we are as part of like a leading university in Brazil. We kind of like have our own organization of universities, trying to engage them in activities like that, in exchange of technologies, attending international fairs, attending or relating to, for example, the U.S. Competitiveness Council. But also as a university by itself, I guess the better way of like showing how to improve the system is like having real cases. And we are chasing these real cases every day. During this week, I have like only on Monday and Tuesday, I have visited at least 4 companies trying to set up cooperative projects, pharmaceutical companies, software companies, and I still have like 3 more to go tomorrow. So I guess that's basically what we can do as a university, like having the homework done, because in some sense, I would say, sometimes when we have this kind of panels, I have the feeling that we're always touching the problems that we have. In my sense of, in my view, actually we have much more opportunities that were open in the last years that are not really seizing, and then really like major worries about the problems that we have. I know we have to work on the problems, but also we cannot lose this window of opportunity given already by the recent changes that we had. That's, I would say, my philosophy in terms of leading the licensing and commercialization effort inside the agency.
Other questions, sir?
Yes, hi, Floriano, Congressional Fellow here. I'd like to know if Genua is a public listed company, or if not, if you are intending to go for any IPO anytime soon. And also, how would the Brazilian speakers would respond to this criticism that was presented here by Raim? In fact, a very common criticism that there is not much of an interaction between universities and the industry in Brazil.
Genoa was organized to go to an IPO in the future, and we expect to go through this in 3 to 5 years from now. We hope. And the criticisms, some points I think are true there. They are the culture of biotech development and the transfer from the technology from the universities to the private sector are very difficult. There is no such culture and no such a policy from the university. Innova is an exception in Brazil, because USP is extremely difficult. You deal with transfer of technology. The bureaucracy is extreme and it's very difficult. What is amazing, there is enormous interest from the mainly pharmaceutical companies in the USP, mainly University of São Paulo. That's a traditional institution in Brazil, and this negotiation is extremely difficult between the parts. And I think it's a process of education that we are passing through now, and I think we will go more years to achieve this skill of negotiate with private companies and to commercialize our findings there.
Well, as I told you before, we always need to go the extra mile in Brazil in order to accomplish things, because things are new. But I don't see this quite. Sometimes I see these things as an opportunity. For example, if you say that Brazil has this reputation that university and industry does not team up together, which is bad for my business, but actually I see as a very nice opportunity, because when I go there and I talk to these guys and I can show, okay, we can do this, we can do that, we have this already and have this already, and actually this creates a kind of pleasant surprise and makes all the negotiation process go smoother. So this is like part of that we have to do. And I would say this is good, like for we as our Brazilians, like actually we like this kind of challenge. We never had things for granted, so we kind of got used to that. But I'm pretty sure, but at other times, sometimes we have, like, for example, this bureaucracy, some of these difficulties. Sometimes some of the statements that I heard, either from the industry or from the university, are not completely true. Are much more like they are kind of like want to place their positions and flexing their muscles. I was seeing the presentation of Rain. Some of these companies that he was listing here, one of them I was complaining, it's bad to talk and to do business with university. But one of the reasons that because they came to us and okay, I didn't like the negotiation terms, so I'm not gonna do it business with you. All right, this is like part of life. But they actually want to use like in putting pressure and going from other ways in order to say, okay, university cannot make deals with the industry. Well, that's not so. Sometimes like there is a lot of misconception, and it also happens in the opposite way. Sometimes universities talk also speaks sometimes stupid things, but actually they're not reflecting the real thing. I guess we have to be more pragmatic. That's, I would say, the word that's going to help in order to achieve the results that are really. And we are still missing. I guess we can make much more than with the environment that we have already.
Yeah, I just make a couple of observations there. I've attended a number of conferences and talks and things like that in Brazil, and you hardly see in the same conference a good split of academia with private industry. You either get one or the other. I think part of the challenges, and the reason I raise that is part of the challenge, I think, is just they do not know each other. They do not know the challenges that each other has to face. To a higher degree, I think the industry understands the challenges of the academia, but the academia doesn't quite have the knowledge to appreciate what it takes to develop a drug, the complexities of it. And I think a little bit of education will go a long way to actually get people to understand each other's challenges in a sense. So, and speak the same language. But I agree with you that it is not uniform. It's very different. In fact, when I talk to people, Unicampi came up time and again as being exemplary in this regard, that being easy to work with. So it's all a relative thing. But unfortunately, Unicampi does not seem to be replicated elsewhere in Brazil, at least to my knowledge.
The woman there in the back, please. Yes.
Hi, Kate Ambrose with the Latin American Venture Capital Association. I just wanted to come back to an issue that you all touched on in different ways. Katya referred, very adamantly to a complete lack of venture capital, and you defined it as venture capital. Diogenes, I think, had a couple of bullet points there where there's a question to what existed in terms of funding, but you also had examples of $7 million going in with seed and angel investing, which is a very positive example, and also all of these companies, more developed companies, supporting and contributing to innovation and funding of new ventures. And Rahim also had a bullet point that said, lack of private equity, but had cases of companies that had successfully developed and apparently achieved funding. So I'm wondering, from among the three panelists, if you are actually agreeing, if there are points of agreement or disagreement here. I would argue that there certainly is a venture capital market. It's something that I see every day, and more so in Brazil than in other parts of Latin America, but at a much later stage. The seed and angel investing that you need for real innovative investment in a sector like biotech is probably very difficult to come by. And just wonder, what your opinion is on that.
I would like to talk about as being a private company. This is the major point. The city and angel capital is very difficult. You don't have money to start, a company. BNDES only created a fund for city money in January 2007, last year, January 2007, and they have $50 million to invest as city money in the companies, but just 1 year ago. And so, since now, they approved only 4 projects because they are so strict in the liberation of the money. They are so bureaucratic that it turns almost impossible. And if you think we took 2 years to get the money from BNDES, this is too long for any company. You can wait for so long. It's too much time. What we do, we invest in research and development, doing services. So we have a part of the business is services, and we have been founding our own company, the research and development part, using the services. So this is the most important thing. The BNDES, the most important enterprises they have founding are the big companies in Brazil. Petrobras, Embrapa, Suzano, papel e celulose, they are huge companies in Brazil. So the main investments from FINEP and BNDES are for these already well set and well organized, very nice and very huge companies. So it's difficult for us that are small. So you keep big companies with some kind of investment, good source of investment, but the little ones, the small ones suffers with this. And the private investment is very, very difficult for us, for the small companies. It's a very complicated thing. Even for BNDES, they ask for guarantees. So they have interest rate very low. We pay 1.25 a year interest rate, but they require bank collateral. Then you have to pay 3% in bank collateral. So you don't have any advantage because you are paying almost what we will pay in another way without the investment.
It's a changed environment, so that's why sometimes you see different opinions talk about the same subject. Specifically for the venture capital industry, what I can say is the following. The venture capital activity in Brazil is very recent, so in gross numbers, it's still small, but it's like increasing 40% a year. When we talk with these guys, what is happening is the following: there is more money that can be used. They are not being able to find enough amount of money with enough amount of business to invest with the money they have already. Actually, they kind of are looking for opportunities. They're looking for other Genoas. But because the activity is very recent, the venture capitalists, they're not really behaving like venture capitalists. They want like kind of mature companies, which is very difficult to find, even in Brazil, because there is no not real very good business without being assisted. So that's why this kind of industry, the venture capital activity, is not maybe growing as much as they should. Once they start into decreasing the risk or the perception of the risk in Brazil, and they start learning about Brazil and see the real opportunities, I'm pretty sure that is gonna we are not gonna have the growth rate, but also gonna have in gross numbers the same kind of amount of investment that you're gonna see, for example, in countries like in North America.
What I can say about the VC in Brazil, I don't understand it completely. So, but from the companies that we studied, 4 of them had venture capital investments, and most often in combination with angel investors on the side as well. Having said that, these investments were made over 3 or 4 years before. I haven't come across any companies that we recently invested in. So that's the trend, unfortunately, doesn't seem to be, instead of increasing, it's kind of stagnated to some extent, which is not encouraging. That's one thing. And the extent of investment in these companies were fairly small. Sometimes somewhere around 200,000, sometimes 100,000, sometimes. And none of the ones that invested, to my knowledge, have divested so far. So this, unfortunately, speaks to the exit strategies or lack of for VCs, angel investors too, and it could be part of the reason why people tend to shy away with biotech. Another reason is often people complain that people just don't understand, the VCs don't understand biotech in Brazil, and that seems to be a major challenge. So they cannot really assess the risks accurately because they don't understand it. So that's the one side. The angel investor side, there actually seems to be quite a, it's judging by very small numbers, but it doesn't seem to be that difficult to find angel investors in Brazil, but you have to make them understand what it is they're investing in. And there's one legal issue with it, which is that my impression is that when people invest in companies as angel investors, they become liable for the activities of that company should something happen. And that seems to be quite a deterrent, particularly for investors that come from outside, which are mostly sensitive to.
What are the questions, sir?
Chachin, freelance correspondent. What is the Brazil incubating policy for biotech company?
Is your question about incubators, sir? Incubators, okay, about incubators.
We had an experience. We were visited by twice by a commission from South Korea, offering us to be in an incubator space in Korea, in South Korea. And what they offered was space with a low prices to set up a lab there, and advantages in taxes, each employee that you contract, and 20 years of long to pay the taxes in the South Korea. And this is why I believe it's an incubator space, an incubator environment. We don't have this in Brazil. You don't have an incubator facilities to locate for location or for taxes or to hire people in Brazil. You don't have this kind of policy. And I think this is the most important thing. As the Brazilian government start to do some policies to make or to enhance the clusters of biotech in Brazil, I think will be very, our growth will be astonished, because we are very involved with the development and with biotechnology. And we are completely outside the clusters of biotech. They think, they discuss that inside the United States, if you are in a cluster of biotech, it's much easier to develop, to go on with your enterprise. Get alone being in Brazil, that we are completely outside any kind of this, the cluster of development and biotech.
Is the government going to have one policy? Because this is very important for a new company to generate.
Sorry?
Does the government, you say, you are talking about Korean policy. I'm asking, is this, were Brazil government going to have a policy?
No, it don't. So this is the point. Brazilian government doesn't have these policies. This should be the important to development, but in Brazil we don't have it.
The only comment I would make is it seems to me that the incubators that currently exist, like the Biominas Foundation in Belo Horizonte, another one, BioRio in Rio de Janeiro, these things, my understanding is that mostly they came about in the 90s as a result of the federal government cutting back support for R&D in the biotech area, and the states come sort of stepping in. So they tend to be more state led type of initiatives. and at least the Biominas Foundation has been fairly successful in graduating companies. A number of companies that we studied said that they were either from Biominas or another one, or there was a couple of them actually located in BioRio Foundation, and a few other ones that came out of incubators at some point or other. So the few that do seem to exist seem to graduate a number of companies, at least as far as we know.
I just would like to elaborate a little bit more on the regulation for incubators and things like that. Yes, in Brazil, yes, if you go to an incubator, you receive some kind of assistance. Small companies in Brazil, they have like special tax treatment when compared to regular companies. So in this sense, yes, there is a kind of policy or government regulation try to provide incentives to small business to grow. But this is not enough for biotech companies, because biotech is a very special case. It's a long, the incubation process are the time that the company is going to make generate results is longer when compared to other small business. So I guess that's probably part of the problem. But if you say no, Brazil, there is yes active policy to stimulate small business, technical business, but maybe not enough, especially for this biotech sector.
What other questions might there be in the audience? If I could just offer a moment of summary from this panel. Institutional economists explain that when you institutionalize patents, what you're supposed to get is two outcomes. One is that patents are supposed to provide an incentive to encourage technology innovation. And all the stories that we've heard here in the Brazil case study essentially have been post-1996. And so the passage of the patent law seems indeed to have encouraged technology innovation. The second thing that institutional economists say is that patents are often, or perhaps nearly always, quite critical to effective technology markets, which is another way of saying what the public-private partnerships, the collaborations, et cetera, that are going on. And one of the things that I note is that it was said on a couple of different occasions that law of 2004, the technology law, looks very much similar to what we in the United States, what Stephen Merrill lived through, which was our Bayh-Dole law. The 2004 law was it seems to many Brazilians, a sort of reaction to the need to create more institutionalization of the patent regime, because it was unclear about universities and whether they should be getting patents, and then you get into all these stories back and forth about public sector, private sector, about trying to effectively carry out a partnership, and the negotiation and the questions of patent rights and who knows about patents and who doesn't, and royalties and all that. And so one of the things I think we note is that the evolution in Brazil over the last now 12 years is actually quite consistent with what institutional economists would expect. And Rahim's comments, many of them were actually very much like a business school guy, even though he's at in global health. It's also very consistent with what business school guys would say about the learning that has to take place, all this discussion about venture capital development, and this notion of risk, and how it was sort of repeated often that maybe the willingness to embrace risk is not very deep in Brazil, and perhaps with very good reason, because for a long time there was a great deal of macroeconomic instability. So it might not be surprising that it would take a while to be willing to take on the kind of massive risk we're talking about in biotech, as Rahim was trying to explain. Here in Washington, we are especially interested in policy matters, not just in sort of the business of it. And so we would also highlight a couple of other things that were either stated or just below the surface. And that is that the Patent Office is important for its ability to carry out, as a matter of public administration, the patent administration, so that companies are able to relatively quickly know what their bargaining leverage might be. Now, what the companies seem to do is to be, in fact, Ricardo's numbers showed it. There was even one company that had hugely more. It was actually Fiocruz, I think, not actually a company. But Fiocruz had more international patents than they had domestic patents. In talking to Brazilian companies, you find that that's an increasing phenomenon, that they are patenting internationally for the purpose of ensuring that they will be able to execute their business strategies because they know that their home patent office is not really quite effective yet. And so it's a means of overcoming the weakness at home. Now, but in addition, there were a couple of other things mentioned that are worth recalling. The uncertainty created in the biomedical areas because of the participation of, Rahim mentioned Anvisa, that's the Brazilian FDA. It's an extraordinarily unusual policy in the world to have the Ministry of Public Health in the capacity to review whether or not a patent will be granted. And all the Brazilian companies tell you that it creates a level of uncertainty because they don't know what the decision-making process there. It's non-transparent, and there isn't enough of a history yet to sort of be able to predict based on history. The other thing is that if it's biodiversity related, which we didn't really talk about at all, then there's another level of uncertainty there because there's very much some legal uncertainty about if you're working with biodiversity-based knowledge and products about how the patenting situation will be handled, as well as where the royalties might go. Traditional knowledge especially raises this question. There's a great deal of uncertainty in Brazil, and this is a big issue for technology innovation because there's so much extraordinary science that's been done in Brazil for really 100 years in areas of biodiversity that create tremendous opportunities, in particular for drug development. And so this is a level of uncertainty. Now, it's also the case, and I'll just say this is the finally for us here in Washington who are so interested in policy matters, that what was also not mentioned is that for those who are a little further down the line with respect to their drug development, that the Ministry of Public Health also comes into play with respect to price controls. The joint profile in innovation I told you that is sitting outside on the desk there with Dr. Falsi from Biolabi and Dr. Camargo from Institut Butantan, Center for Applied Toxinology. One of the stories that Dr. Falsi likes to tell is that they did a sort of, you might say, modest incremental innovation that involved, I think it was vitamin D. But at any rate, they took their innovative vitamin, and it was to be used with pregnant mothers, and they figured out how much money the government of Brazil would save because the government gives them away. So they figured out how much they would save, and so they priced the innovation accordingly so that they would save a good deal of money. And I've got the numbers written down. I think it's something like they went to the government and said, we'd like to charge 24 reais per pill, and the government said, no, you'll sell it for 4. And Dr. Falsi likes to say 4 won't buy the packaging for this product. And so, but there's an unfortunate outcome here, which is that they didn't distribute the product then in Brazil. And instead, the last time I talked to him, which was in May, he said they were trying to find a licensing partner in the United States and Europe. So they'll just basically license it internationally and have somebody else sell it in the United States and Brazil. I mean, in the United States and Europe. And so if those kinds of, as people like Katya move further down the development path, these kinds of questions are going to become very much of the fore and much debated in Brazilian circles, because I can also tell you of other companies in Brazil who have already decided to pursue their development strategies more in Europe and the United States because they know what the outcome will be and they're uncertain about what the outcome is, which is why I took actually really note when Katya said at the end, you might think that she was just being patriotic or something. Well, she actually was saying something meaningful when she said, we are committed to innovation in our home market. Not every Brazilian company is, because they recognize that the gap between the policy environment today and what it needs to be is substantially enough big that they think that they may need to take their investment money and their angel money and their venture capital money and the pressures that that brings on them to international market development opportunities. And it would be a pity if that is what happens, because we know what a tremendous impact these kinds of technology innovations can have economically. And with that, I thank you so much for the opportunity for us to be with you today, and I'll thank on behalf of my colleagues, I guess. So thank you.
Thank you, Michael, very much for having acted as a moderator and also for your comments during the panel. Well, this just shows in everything that we listened to. I was in my office, but we can follow it online. So I was kind of here also. Shows that this is really a debate that will continue. We intend to remain a part of it. As we conclude this, I want to remind you that the proceedings, the video of this seminar will be available online in about a week at the website. We are going to produce a publication summarizing the interventions. I wanted to thank you, my colleagues from the Wilson Center, especially Alan Wright, the program assistant at Brazil Institute, also Matthew Layton, Michael and Paul that helped with the video, Heidi, photographer. It has been a pleasure to host you here, and stay tuned. All the documents are going to be available on the website, and I hope you stay also current about our activities here. I believe that we do many things. We have 800 events at the Wilson Center, average per year. Next time, I think our next public event, we'll take a break now in August. We return in September to highlight something that's very important to us, to me personally. It's less controversial, which is literature in the Amazon. Very important writers from the Amazon will come here. We have a very varied program focusing on race relations, Brazil-U.S. business relations, Brazil-U.S. political relations, and we are obviously, to those that are part of the Brazilian American community here, we are very much open to your suggestions, to your ideas. As you may have noticed, we make a point on not taking sides precisely to allow debate. And, we like to think that by doing that, we do that in the hope that, we help somehow forge better public policies. And what we really like to say here at the Wilson Center is that we strive to produce light and not much heat. And with that, I wanted to thank again Diogenes, Katia, Michael, and Rahim for their contributions. Thank you very much.